We are in a digital age now. So, the moment a child is born, I think one of the first things which you put into the hand is a mobile phone, and they become very adept at it. Sunlight exposure is something which we see which is decreasing in children right now. There used to be a time when children, when you come back from school, they used to go to play. That's not happening very much. One thing which I recommend parents not to do is to massage the joint.
It's important to know what not to do more than what to do.
What to do, correct. Flat foot is something which is normal in children. Under 5 years, most children have flat feet. More than the parents, as the grandparents who are more concerned, saying that കൊച്ചിന്റെ കാലിൽ വളവുണ്ട്, എളുപ്പം പോയി ഡോക്ടറിനെ കാണിക്കാം.
ഇവിടെയുള്ള ആൾക്കാർ especially have preconceived notion. ഇതിങ്ങനെയാണ് ട്രീറ്റ് ചെയ്യേണ്ടത്.
A person a child who sits inside the room all day, stares at the screen is not going to be healthy. Pulled elbow is something which can be treated very easily, but it should be picked up into it. Early walking can cause harm to the child's leg, and the practice of using walkers should be discouraged.
Welcome to our podcast. Today we have a very special guest, Dr. Praveen S Jose, who's the Senior Consultant Paediatric Orthopaedician in SP Medifort Hospital. And I would also like to welcome my co-host, Dr. Aathithya, who's also our Executive Director and Orthopaedician of our hospital, SP Medifort.
Hi, Doctor. So we all know orthopedics ഒരു സൂപ്പർ സ്പെഷ്യാലിറ്റി ആണ്. എന്തുകൊണ്ടാണ് ഒരു പാരന്റ് അല്ലെങ്കിൽ ഒരു പാരന്റ് അവരുടെ ഇൻഫന്റിനെ why should they come see a pediatric orthopedician?
So like you said, like orthopedics, everybody knows about orthopedics. It's a branch of medicine which deals with the problems of bones, joints, tendons, and ligaments. Over the past many years, orthopedics has sort of subspecialized or diversified into different groups or different specialties. So you may have heard of joint replacement surgery or arthroscopic surgery or keyhole surgery. So one such subspecialty of orthopedics is pediatric orthopedics. So pediatric orthopedics is a sub-branch of orthopedics which deals specifically with the orthopedic problems of children. So by children, we mean from newborns to teenagers. So why should a parent seek out a pediatric orthopedician instead of an orthopedician? So there are a few differences when you talk about the musculoskeletal systems of the child as when compared to an adult. So when we talk about the child's bone, it's very much different from an adult's bone. To give a very clear example, a very simple example, if you go to a tree and take a branch out of it, it's that brown, dry branch that you see. And when you try to break it, it just snaps. That's an analogy for how adult bones break. It just they snap. Now, if instead of going to a tree, you go to a young plant or a young sapling and you take a branch from that, that's a green colored slab, and you try to break that, what happens is it bends initially and then only it breaks. So that's how a child's bone is different from an adult bone. A child's bone is much softer than an adult's. It takes a lot of force to break a child's bone. In addition to that, there's another difference in the terms that a child's bone is still growing. The growth is a big part of pediatric orthopedics. So a child's bone has something what we call a growth plate on both sides of the bone. And there are injuries which affect these these sites on the plane. So these are things which a pediatric orthopedician takes care of. So I'll tell you a very interesting fact. The word orthopedics, it was coined in the 18th century. And it's made up of two words. Ortho and pedia. Ortho means straight. Pedia means child. So that is the root of orthopedics. So pediatric orthopedics is the root or the foundation of this specialty that we know as orthopedics, right?
That's the first lesson we learn on the first day of MS.
On the first day of MS, yeah. So that's how important pediatric orthopedics is, yeah.
So നമ്മുടെ physiology itself different ആണല്ലോ, pediatric and adult.
Yes.
So obviously we have to meet or come see a pediatric orthopedician because the treatment style will also differ.
Yes, it does.
So as we know, and the കുറേ common reasons ഉണ്ട് ഒരു parent childുമായിട്ട് നമ്മുടെ OPD-യിൽ വരുന്നത്. What are the most common reasons or causes that you see that the child is bringing, that the parent is bringing their child to the OPD?
So there are different types of medical problems that we see in children with regards to orthopedics. So one such group is congenital disorders. Congenital disorders are the disorders with which the child is born with. All right. So I'll just give you two examples. One is what we call club feet. So it has a long medical terminology. I won't go into that, but laymen call it club feet. So what happens in club feet is that the child's feet are twisted inwards when the child is born. Another one disorder which we see when the child is born is called DDH or CDH, which is called congenital dislocation of hip, in which the child's hip is dislocated when the child is born. Okay, so just examples of congenital disorders. The next group of disorders, they can be called developmental disorders. So these happen when the child is developing or when the child is growing. And in my practice, I think this is a group which I see the most. Okay, so again, some examples which I'll tell you. One very common condition with which parents come to me is called flat foot. What happens nowadays is there are medical personnel who go to school for screening of like deformities and flat feet in children, and they scare the parents. And they tell them, oh, the child has a valava. And this valava will get worse with age, and the child will have difficulty walking, and they'll scare them. And the parents come to me fully concerned, full of tension, and they're very concerned. So when it comes to flat foot, let me reassure you. So flat foot is something which is normal in children. Under 5 years, most children have flat feet. Okay, and the type of flat feet which I commonly see is what you call a flexible flat foot. What does it mean? Flexible flat foot means that when the child is either sitting or lying down, the foot appears absolutely normal. And if you look at the inner part of the foot, there's a very well-developed arch that you can see. So when the child is standing or walking, at that time the arch becomes flat and the foot becomes a little bent. That is what we call a flexible flat foot. And again, I'm saying it's a normal phenomenon. In children, it's a normal thing. There's nothing to be worried about. And in most children, this flat foot resolves on its own as the child becomes older. All right. Another example, another condition with the parents bring the child to me with a lot of stress is what we call bow legs or deformity of the legs. So parents start noticing this deformity when the child starts walking, and they are very concerned. More than the parents, as the grandparents who are more concerned, saying that the kochinte kaalu valavundu, elappam poi doctor ne kanikka. So the parents come to me. So bow legs again is something that we see normally in children, especially in children who just started walking. So the normal bow legs, the usual bow legs that I see usually settles on its own. It usually corrects on its own by the time the child is 2 years of age. So for the vast majority of children, we don't need to do any treatment or bracing.
It's important to know what not to do more than what to do.
Correct, yes.
Sir, is there any specific age group? ഇപ്പോൾ ഒരു നമുക്ക് പീഡിയാട്രിക് ഓർത്തോപെഡിഷനെ കാണണം എന്നുണ്ടെങ്കിൽ എത്ര ഏജ് വരെയുള്ള കുട്ടികളെ നമുക്ക് കാണിക്കാൻ പറ്റും?
Okay, so as a pediatric orthopedician, I see children who are growing. So there is a particular age at which girls and boys stop growing. So as a rule of thumb, from a newborn to say about 14 years in girls and to about 16 years in boys. So that's around the ages when the most of the growth is completed.
Sir, commonly കാണുന്ന injuries കുട്ടികളിൽ എന്തൊക്കെയാണ്?
Okay, so children are very active individuals. So if you have seen a child, they're constantly running around, they're constantly climbing up things, they're jumping from places. And in the middle of all these activities, falls are very common. All right. Some of the common injuries that I see are sprains, ankle sprains, when the child lands on the foot and the foot twists. That is one injury. And there are fractures. So there are fractures of the upper limb or the hands and of the lower limb. So normal day-to-day activities, and when the child falls, they tend to fall on the non-dominant hand. Also, suppose the child is a right-hander, the child tends to fall on the left hand, and the child can sustain a fracture of the hand. By hand, I mean fractures of the wrist, the forearm, the elbow, or the shoulder. So one of the commonest injuries which I see in children as one is fracture of the forearm bones or the wrist bones. And other children, they come with fractures around the elbow. One particular injury which I want to talk about is what we call a pulled elbow, which is which I see quite commonly. A pulled elbow is essentially a dislocation of one of the bones of the elbow. And how does it happen? So when a child is running around, the tendency of a parent is to catch the forearm and restrain the child. When that happens, when you try and pull the child by the forearm, one of the bones of the elbow dislocates and the child starts having pain around the elbow, and the child stops moving the elbow using the forearm. So one of the things which I advise parents is never to pull the child by the forearm and never to lift the child up holding the forearm. Okay. If a child has something like a pulled elbow, please bring it to the hospital and we'll deal with it. With particular reference to injuries around the elbow, if a child has fallen and you see that the child is having pain around the elbow and there's swelling around the elbow and the child is not able to bend the elbow, one thing which I recommend parents not to do is to massage the joint. It's a very common reflex or a common tradition. So when a child falls, the first thing to do is to massage or to give an oil massage. Massage is not recommended for injuries in children because that can actually worsen the injury and it can worsen the outcome of the treatment.
So it is very important for the parent to ideally know what should be done, what shouldn't be done, when they should come to the hospital. Because say if they do something wrong, say a treatment like a native splinting or anything like that, and finally when they come to the hospital, the issue would have been a bit more exaggerated.
Yes.
So parent awareness is very, very key while we are treating acute injuries in pediatric children.
So if a child falls and hasn't had an injury, if the child is very uncomfortable, child is not moving the limb, it's best to go to the hospital, get x-rays done, make sure there's no fracture. If there's no fracture, then you can always go in for a massage or whatever, but always rule out a fracture before you start any native treatment. Okay, so I'll just give you a case example of a child who came with a pulled elbow. This is a 2-year-old child who thinks he's Spider-Man.
Yes.
So what he does in the house, he climbs up the window frame. And suddenly one day, when he was climbing up, he nearly fell off, but he somehow managed to grab on. The parents brought him down, but the child was crying. On being asked what the problem is, child is touching his elbow and the child is not moving his arm. So the parents are worried. They didn't see the child fall, but something has happened and the child is not moving the elbow. The parents are worried. Has the child paralyzed the hand? Will the child be able to move it? Okay. So in such a cases, ideally the patient should bring the patient to hospital, the child to hospital. So this child, when he came to hospital, he was playing with his left hand, but the right hand he was holding by his side. He was not moving it at all. And when I tried to shake his hand, he was refusing to shake his hand with the right hand. So when I heard how the child developed this pain, I sort of knew this was a pulled elbow. So the treatment of pulled elbow is actually quite simple.
Very simple, yeah.
But it's very magical actually.
Correct.
So what I do is I manipulate. I just twist the elbow a little bit and I
to relocate back to the joint.
To bring the bone back to its position. I keep a few toys in my outpatient. So once I do that, so when that moment is a little painful. When I manipulate, when I put the bone back, it's a little painful. So child will start crying. So what I do is I give my toys to the parents, tell them you sit outside, wait for 10 minutes and you come back to me. Invariably, in 10 minutes, the child is happily playing with the toys with both the hands. Parents also smiling. Grandparents of that, they're also smiling and everything is fine. So a pulled elbow is something which can be treated very easily, but it should be picked up into time. Yeah.
So we have also seen a lot of neglected pulled elbow, They would have seen a dislocated elbow. They would have done another treatment method which wouldn't have worked, which would have landed in a permanent deformity. But that is very, very scary. So it's very important when to come to the hospital, the parents should know.
Yes.
So next is, say I had an adult patient a few years back. So he had a both bone, a few years later, he had a kid. The kid also had the same fracture. So this guy came up to me and he said, Doctor, enike sambhavicha same fracture aanu. Adebole namakku treat cheyamo. What is your take on that?
Earlier, I talked about how a child's bone is different from an adult bone. All right. So a child's bone, like I said, is very soft. It takes more force to break it. It tends to bend more than break. Another feature of a child's bone is that normally all our bones have a covering. It's called periosteum. It's a long medical term called periosteum. What the periosteum does is it gives blood supply to the bone. It provides blood supply to the bone. And in a way, it supports the bone when it's broken. So when you talk about adults, in adults, what happens? The periosteum is very thin. So when a bone breaks, the periosteum does not have much of a role to play in supporting the bone. In contrast, the child's periosteum or the bone covering is quite thick. All right. And when the bone breaks, the periosteum tries to hold it in place and prevents it from getting displaced too much or move apart too much. So that is one thing. So a child's fracture tends not to displace as much as an adult's fracture. That's one. The second role of periosteum is that it helps in bone healing. So like in an adult who has a very thin periosteum, often that does not heal as fast as is in a child, because a child's periosteum being thick, and it's very helpful in healing of the bone. So when you come to an adult's fracture and a child's fracture, an adult's fracture will take a long time to heal without any intervention from our part. So mostly in adult patient, we need to operate and put either a plate or a nail inside to hold it in place till the bone heals. In a child's fracture, what we can do is we can just straighten out the bone and put the child's hand in a plaster. And in the plaster, usually the fracture heals very rapidly, very quickly.
So adult fracture treat ചെയ്യുന്ന പോലെ നമുക്ക് pediatric fracture treat ചെയ്യാൻ
പറ്റത്തില്ല ആവശ്യമില്ല അതുപോലെ ട്രീറ്റ് ചെയ്യേണ്ട ആവശ്യമില്ല. So the role of surgery is very much less in children as when compared to adults. One more thing I want to tell you about the child's bone is, if an adult bone fractures and is not treated in time and a bend develops, that bend doesn't get right on its own. You need to correct that bend and operate and put a plate inside. In a child's bone, this periosteum and the growth plate, which I talked about earlier, even if there's a small bend in the bone, it can straighten out automatically. So in very small children, if there's a slight bend, you don't need to do anything to treat that bend. It'll settle automatically.
So it's important to know when to not put the patient under the knife.
Yes.
ഇപ്പൊ നമ്മൾ ഒത്തിരി കേട്ടിട്ടുണ്ട് കുട്ടികളിൽ ജോയിന്റ് പെയിനെ പറ്റി. സോ ആൻഡ് വേറെയും കുറെ പേര് പറഞ്ഞിട്ടുണ്ട് ഇത് വളരുന്ന സമയത്തുള്ള പെയിൻ ആണെന്ന്. ഇസ് ദർ എനി ഫാക്ട് ടു ഇറ്റ്? എന്തെങ്കിലും അതിലൊരു സത്യമുണ്ടോ?
So I see a lot of children with pain, leg pain specifically. All right. So this is again a condition which worries the patient, the parents very much. So the most common cause of pain which I see in children is something which we call growing pains. Okay. So if you look for it in a medical textbook, you won't find it. There's no definition of growing pains or what causes it or what else. So what growing pains traditionally has been thought to be is that when the child is growing, the bones grow, and that growth along with the muscle growth causes pain in the child's. Usually it's the legs which are affected, usually around the knee or the leg or the feet. So typical features of growing pain is that the child is absolutely fine during the daytime. Child is active, playful, able to do everything. But usually in the evening or by night, the child tells the parents that is the child, the foot or the leg is paining, and asks to be massaged. Okay, that is typical growing pains. So when should a parent be careful or concerned that it could be something else other than growing pains? One is if the pain is persistent in the daytime, the child has pain during the day also. If due to the pain the child is limping, or there is a difference in the way he or she walks, if there's any associated swelling of the leg or the hand where the pain is, and if the child is having other symptoms like fever or the child is not eating properly, these are red flags, and the parent should bring the child to a hospital for checkup.
So it's very important the parent അവർ കാണണം അല്ലേ, ചൈൽഡിനെ കാണണം, because the child wouldn't be able to tell what type of pain, ഏത് character of pain എന്ന് maybe childന് പറയാൻ പറ്റത്തില്ല. And if neglected, we would have seen a lot of cases in the OPD where a neglected pain or a diurnal variation of pain can lead to something called tumors in the bone.
Yes.
How do you see that aspect of
So when a child comes to me with pain, there are a list of causes which runs through my mind. So like I said, one of the first or the top in the list is growing pains, which is a normal phenomenon in children and which usually settles on, which nothing has to be done for it. Apart from growing pains, there are other things which I think about. One is infection. Bone infection can cause bone pain. Another thing which you mentioned about joint pains, children presenting joint pains. There are types of arthritis which affects children also. No, usually when we talk about arthritis, we think about elderly people having knee pain. That is osteoarthritis. But there are types of arthritis which affect children also. They're called juvenile idiopathic arthritis, and these arthritis can cause joint pains also. That is second. Rarely, tumors or cancers, they can present. On the whole, cancers are rare, but they can mimic other conditions and they can present as bone pain. So, like I said before, if the child is having difficulty in walking, if there's swelling, if there's fever, child is not eating properly, the child should be brought to medical attention. So, a 3-year-old girl was brought to me by her parents, and the complaint was the child is having pain over both the legs for some time. The first thought which usually crosses my mind is growing pains. As a child, it has to be growing pain. But then I examined the patient. I looked at the child. So now usually a child with growing pains is very active, very playful. They don't sit in their parents' lap. They tend to run around the consulting room. They play with my toys. But this child was sitting quietly in my mother's lap. And when I looked closely at her, she was looking very tired. She was not making eye contact. And I asked the mother, how is the child otherwise doing? Apart from the pain is the child all right? Is she playing? Is she eating well? So the mother says, no, the child is rather tired. She's not playing as before. She's not eating as well as before. So looking at the child as a whole, so I knew this was something more than growing pains. So I asked for some tests. I asked for some x-rays of the leg, and I asked for blood tests. Unfortunately, the tests showed that there was a cancer in the blood. It was a type of a leukemia which the child was having. So the child presented with leg pain, which is a very common presentation in children. But ultimately, it turned out to be something far more serious and far more dangerous.
Because I remember 2 months back, I referred a patient to you. That's an 8-year-old. അപ്പം ആ മദറിൻ്റെ കംപ്ലൈൻറ്റ് മദർ പറഞ്ഞത് എന്താണ്, സാറേ 2 ലിംബിൻ്റെയും 2 കാലിൻ്റെയും ഹൈറ്റ് കുറവാണെന്ന്. And what did we do to that kid?
Yeah, I remember that child. So it was an 8-year-old boy, I think. And the parents had been noticing that one leg was shorter than the other since early childhood. But the child otherwise is absolutely fine. The child doesn't have pain. He doesn't have any problems in running or playing or jumping. But the parents were concerned that one leg is shorter. They just came for an opinion. And I think we got an X-ray done. And what we found on the X-ray is that one of the hips was shaped differently. The shape of, I think that was the left side, was different. So this was a child with a condition called coxa vara. Coxa vara in simple term means there's a bend in the hip joint. So because of that bend, the child was having a shortening of the leg. So if we remember right, we did we did a surgery and we cut the bone and we reshaped the bone and we put a plate inside, and the child is now walking absolutely well, and the leg lengths are equal.
Till what limb difference can we manage? ഒരു ചെരുപ്പിട്ട് എല്ലാവരും പറയല എത്ര ഹൈറ്റ് അല്ലേ കുറവുള്ളൂ, ഇത് നമുക്ക് ചെരുപ്പിട്ട് അഡ്ജസ്റ്റ് ചെയ്യാം. എത്ര കൂടുതലായാലാണ് നമ്മൾ ഈ ഓസ്റ്റിയോട്ടമി അല്ലെങ്കിൽ ഒരു സർജിക്കൽ കറക്ഷനിലേക്ക് പോകേണ്ടത്?
What medical science says is about a limb length difference, or a difference between the 2 legs about 1.5 to 2 centimeter is usually well tolerated by the body. A difference of maybe 1.5 centimeter does not usually cause long-term problems. But when you are talking about a child may be having a shortening or a limb difference of maybe 2 centimeter now. But that does not mean that difference will remain the same when the child is grown up. What happens in children, a difference in limb length can increase as the child grows. So you cannot just send a child away with, say, a shoe race. So a child with a shortened limb should be monitored regularly. A yearly follow-up should be done to make sure that the limb difference is not increasing. If it is increasing to more than 2 centimeter, you need to address it and treat it.
Sir, in adults right now, everybody, most of them who walk into the OPD, എല്ലാവർക്കും calcium deficiency ഉണ്ട്, അല്ലെങ്കിൽ vitamin D deficiency ഉണ്ട്. What are your tips to parents, to give their children so that we create a new generation without these deficiencies?
So we are in a digital age now. Digital equipment is available to even newborns. So the moment a child is born, I think one of the first things which you put into the hand is a mobile phone, and they become very adept at it. And with that, you have content which is so addictive to any age group, whether it's a child or a 90-year-old person. You just have to start scrolling social media and you will be on it for hours on it. So that is sort of an epidemic which is going on even in children. What essentially happens is that a child who sits in school the whole day, from morning till the afternoon, comes back home and gets onto his digital equipment, either the phone or it may be for studies, but he's still on screen. There used to be a time when children, when you come back from school, they used to go to play. That's not happening very much. So what is happening is, because the child is indoors most of the time, they are not getting exposed to sunlight. And sunlight is a very important factor when it comes to our health, bone health. So what sunlight does, when sunlight falls on our skin, a chemical reaction happens. And ultimately, what is produced is vitamin D. So this vitamin D is something which is really important in bone health. Why? Because vitamin D helps in the absorption of calcium. So even if the child is taking a lot of milk, child is having a calcium-rich diet, if the child is not having enough vitamin D, all the calcium goes to waste. So vitamin D is essential. So sunlight exposure is something which we see which is decreasing in children right now. So that is one thing which needs to be addressed. All children need to be exposed to sunlight. IAP, the Indian Academy of Paediatrics, they have put forth guidelines. So they say that children should be exposed to sunlight, say for about 15 to 20 minutes in the time period between 11 a.m. to 3 p.m. So few difficulties with that is, most of the children, school-going children, are inside the classroom at that time. Secondly, the weather is very unpleasant during that time. So between 11 to 3 p.m., possibility of heat stroke, dehydration, UV radiation is there. So I personally recommend children to be exposed to sunlight in early mornings. So 7:30, 8, before going to school, or when they come back after school. So say between 3 to 4:30. In that time, if they can get some amount of sunlight, that's the additional benefit for them. Second is intake of milk. So when you talk about calcium, what are the sources of calcium? So milk and milk products are the main source of calcium. So I recommend all my patients to take 1 cup of milk every day. There are children who are allergic to milk. They don't tolerate milk. There are alternatives to that. So one is leafy vegetables. So you may ask me, you've stopped milk and you asked a child to take leafy vegetables. That is like from the frying pan into the fire.
So are there any superfoods for the kids for a better bone health? അങ്ങനെ ഉണ്ടോ?
Term superfoods is misleading. It's actually traditional food which are the superfoods. So it's milk, it's leafy vegetables. Okay, ragi. Ragi is a very good source of calcium. Fish, very good source of calcium. We are lucky because in Kerala we have an adequate supply of fish. So most of my children, they eat fish. But these are the other sources of calcium which can be used to this thing. And again, coming to vitamin D, sunlight exposure is the main source of vitamin D in our body. In addition, there are food sources like egg yolks, yellow vegetables and fruit like mango, papaya. All these can be added to the diet to build up their calcium and vitamin D.
Basically, we have to encourage them to go out and play.
Definitely.
And reduce consuming processed foods.
Definitely.
Yes,
So when we talk about play, it's not only about vitamin D. A body which is physically active is a healthy body.
Exactly.
A child who sits inside the room all day, stares at the screen, is not going to be healthy. So in addition to physical activity and sunlight exposure, even for mental development, for mental health, going outside is essential. It's mandatory.
And that also prevents a huge part of children going into juvenile obesity also.
Yes.
So it's very important parents make them do that.
Yes.
Okay.
Yes.
So, any specific advice to the parents?
So keep your children active. Give them a balanced diet. Encourage them to go outside, outdoors, play, participate in outdoor sports. When we talk about sports, parents usually come back saying after the child has played, the child is having pain. So should we send them for sports? Okay, so there are answers to that also. So any sport, if the child is going to, the child needs to warm up before they start the play. So whether it's football or cricket or swimming or whatever it is, the child needs to have a time of warm up to make sure the muscles all stretched out. And once the play is over, and before they come back home, they need to do a bit of stretching to make sure, again, the muscles are not tightened up. So that will help in preventing sports injuries, sports-induced injuries and pains.
സർ, ഇപ്പം നമ്മൾ കണ്ടുവരുന്നത് ഒരുപാട് കുട്ടികൾക്ക് പേരൻസ് വോക്കേഴ്സ് കൊടുക്കുന്നുണ്ട് ടു സ്റ്റാർട്ട് ദ വാക്കിംഗ് ഓർ സംതിങ് ലൈക്ക് ദാറ്റ്. അപ്പൊ അതിന് എന്തെങ്കിലും ഗുണമുണ്ടോ?
I talked about bow legs. So bow legs is a curve of the leg. And it's usually the children brought to hospital at around the age of 1 year when they start walking. That's when normally children start walking, between 1 year to 1 year 3 months. And this condition called bow legs. And this is actually a normal bowing in children. And usually this normal bow, it becomes all right by the time the child is 2 years of age. There are other conditions which can cause bowing of the legs or deformity of the legs. One is a deficiency of calcium and vitamin D. We call that condition called rickets. That can sometimes cause bowing of the legs. There's a third condition called Blount disease. Blount disease is seen in children who are overweight and in children who tend to walk earlier. So like I said, normally children should start walking somewhere between the age to 1 year 3 months. There are children sometimes who start walking earlier, and there are instances when parents make the child walk earlier with the help of walkers. And that is something which should be discouraged. Early walking can cause harm to the child's leg, and the practice of using walkers should be discouraged.
വേറൊരു കാര്യം, പാരന്റ്സ് ആർ വെരി സ്കെപ്റ്റിക്കൽ ഓർ വറിഡ് അബൌട്ട് ദിസ്. ഇത് ചെറിയ കുട്ടിയല്ലേ, ഈ ടൈമിൽ അവർക്കൊരു സർജറി ചെയ്താൽ വിൽ ദേ ബി ഏബിൾ ടു ഗോ ബാക്ക് ടു നോർമൽസി? അവരൊരു അഡൾട്ട് ആകുമ്പോൾ അവർക്ക് നോർമൽ ലൈഫ് ലീഡ് ചെയ്യാൻ പറ്റുമോ എന്നുള്ള ഡൗട്ട്സ് കുറെ പാരന്റ്സിനുണ്ട് ദാറ്റ് വി സീ നോർമലി. വാട്ട്സ് യുവർ ടേക്ക് ഓൺ ദാറ്റ്?
We talked earlier about what is the length difference which does not cause a problem to the body later on. So that is somewhere between 1.5 to 2 centimeters. If the difference between the two legs is more than that, it needs to be treated. There are two ways of doing that. When we talk about, rather 3 ways of doing that. The simplest way is to provide a race under the shoe wear with the child wears. So it's a very cheap and it's a very simple way of correcting the heights. But in a way, it's very impractical. Because if you want that to be successful, the child needs to be wearing that modified footwear throughout the day and for the rest of his life, which may not be possible always. So differences of more than 2 centimeters, we have surgical options which we can offer to the child, to the parents. One would think that if a bone is short, the obvious method or the obvious way to treat it is to lengthen the bone. There are surgeries available for that, but these are major surgeries and they are time consuming. Recovery, it takes time, and rehabilitation is also required. We have another surgery which is called growth modulation, in which we can actually reduce the length of the longer limb. The advantages of such procedures are that it's a comparatively minor procedure when you talk about limb lengthening. And what we do in growth modulation is we put small plates and screws around the growth plate where the actual growth of the bone happens. So the surgery is a relatively minor surgery. It takes less than 1 hour. And there's no plaster. And the child does not need to be in a plaster cast or anything after the surgery. And once the pain subsides, the child can start walking and go to school. Over time, because these plates are present in the bone length decreases and gradually becomes same as the other leg. The same procedure can be done for older children with bends in their leg. Children with bow legs which have not become all right, or older children with knock knees who've not become all right. One option is to cut the bone, make it straight, put a large plate inside, put a plaster, which is a very big surgery. It takes time with a lot of potential complications. For the same condition, we can do this growth modulation surgery in which we put just a small plate and 2 screws, and the child can be up and walking in a week's time. And slowly that deformity or the bend can get corrected. So this is a surgery which I do very frequently, and the children and the parents are quite happy with it. And the best part is the child can return to activities as in a very short time.
You should be very careful when you operate on a child. The level of skill കുറച്ചും കൂടി കൂടുതലായിരിക്കണം. We should be sure that growth plate disturb ചെയ്യാതെ we should operate. And once that is done properly, then recovery is much more faster. And child or adult age they can lead a very normal life.
Normal life, yes.
So thank you. So you broke a lot of myths. So ഇവിടെയുള്ള ആൾക്കാർ especially have preconceived notion. ഇത് ഇങ്ങനെയാണ് ട്രീറ്റ് ചെയ്യേണ്ടത്. Thank you for joining us and breaking so many myths, for throwing light on so many newer methods of surgery. Thank you, sir.
Thank you for having me. Thank you.